Welcome everybody. It's great to have you join us today, especially I know it's half term for some of us, so it's probably likely to be quite a busy week. My name's Rosie McEachen and I'm the director of the Healthy Urban Places Consortium. This is part of the UK Population Health Improvement Network, and our vision is all about how we can improve the population health by harnessing the power of the places we live as tools for population health. As part of our consortium, we invite expert speakers to come and give us an overview of their research. This is the third in our seminar series, and today I'm delighted to welcome Andrew Williams from the University of Edinburgh. So Andrew is a senior lecturer in the School of Health and Social Sciences, and he also co-directs the Scottish Collaboration for Public Health Research and Policy. So very, very relevant and aligned work to what we do in our consortium. He uses quantitative and participatory methods, mostly exploring topics around adolescent health. And he's here today to talk about the evaluation of 20-mile-an-hour speed limits that were implemented in Edinburgh and Belfast, and this was a project that was funded by NIHR. So we are delighted to welcome you, Andrew. The format for this seminar is you're going to give us an overview of your research around about 30 minutes, and then there'll be an opportunity for discussion and questions at the end. So without further ado, I will hand over to you to hopefully share your slides smoothly and get cracking.
Thanks, Rosie. Let's see if I can get this all still working. Is that come up on people's screens?
Yes, I can see that. Thank you.
Perfect. Thank you. And I forgot to say when writing the kind of contributing the introduction, I also work with Sarah, who's on the call here as one of the co-directors for Groundswell. So Urban Green and Blue Spaces in there. I should have remembered that project. But thank you for inviting me along. It's really good to be with you. As you've heard, I'm going to kind of give you a bit of an overview of this project. I was the lead for the quantitative aspect of the project, but the overall PI has now retired. So you've got me. Let's have a look. So today I'm going to give you a quick kind of background to the topic and evaluation. I'm sorry if this is kind of obvious stuff to you, but my background is in public health, so there's a few kind of definitions I wanted to run through. And then we're going to talk through the work packages within the study, which covers the kind of changes in outcomes we assessed and looked at, the policy-making process, how the public experienced it, and often for kind of local authorities, was it worth the money, is what we're going to end up with. And I'll give you some key messages and then time for plenty of questions at the end. So what we set out to do with the Is 20 Plenty for Health project was really to use rigorous and transparent scientific methods to explore what happens and why when 20-mile-an-hour limits are introduced into UK cities, so into Edinburgh and Belfast. So it's really to explore how we got to a point where these two cities implemented 20-mile-an-hour limits, what was learned during the process, so that future initiatives can kind of progress a bit faster potentially, or learn from any mistakes along the way. So this next slide is just my technical bit. 20-mile-an-hour zones are when there is kind of road furniture involved, when there's speed bumps or cushions or chicanes involved in enforcing the 20-mile-an-hour restriction. 20-mile-an-hour limits are purely when there's the signs and painting on the road. So they are a kind of cheaper alternative to 20-mile-an-hour zones. And the evidence base when we applied for this funding was firmly in support of 20-mile-an-hour zones. The question was, can you get similar kind of benefits from implementing the limits, which, because of this kind of, there's less work involved, are cheaper for organizations to implement. So that's what we're focusing on, purely on limits with the signs and paintings on the road. And there were 4 overall objectives or work packages to the project. One was how do various outcomes change or not, which is the predominantly quantitative work package that I led. 2 was if we see changes, why have they changed? What's been happening? More of the kind of process focus, and this was more qualitative. Three focused on how they got to a point where they could implement these policy changes, kind of analysing minutes of council meetings and things like this to understand what was going on. And four was what is the economic value of 20-mile-an-hour limits, and within this we used economic evaluation and modelling methods. To confuse matters, I'm going to deal with them in a slightly strange order. So we're going to look at 1, then 3, then 2, then 4. But hopefully it'll make sense as I tell you the story. The Scottish collaboration that I run has a particular focus on intervention development and evaluation. We created a method called 6 Squid, the 6 steps in quality intervention development. And a lot of this involves putting a lot of effort early into the evaluation process for anything. And when we teach this to students, we say that you should be considering the evaluation of any intervention while you're developing the intervention, because there's things you can really do while you're rolling out an intervention to make sure you've got a more rigorous evaluation. You don't want to miss that opportunity. And I just put this slide in here to show you that this project started with a few of us in a room with a whiteboard, scribbling, trying to get an idea about how the intervention might work, what outcomes we would look at in the short, medium, and long term. And you can see that first version, it then kind of translated into a kind of larger and larger. The text got smaller, more boxes, more arrows as we went through the project, but we were slowly trying to make sense and plan what would be possible. The key part of this logic model is obviously everything was routed through, do speed limits change? So the first part of the evaluation was testing, do the speed of vehicles change on the roads? Did all the activities lead people to drive differently? And if they drove differently, did we see changes in outcomes is what we were really interested in. So work package 1 was there to look at that and the kind of big outcomes that you're mostly expecting. So fortunately, there is in a kind of routinely collected data set on any collisions involving personal injury on the roads. This is data collected by the police when they go out to an incident. It's called Stats 19, and it's quite a rich data set. It tells you about where the incident happened. It gives you a bit of information about what might have been happening, how many vehicles, any injuries. So that was a nice routinely collected data set that enabled us to do some long time series analysis to see if we could pick up any change. In both cities, as part of the intervention, the councils had funded some automatic sensors. So I think these were both the pneumatic tubes that you might occasionally drive over, see across the road to pick up on changes in speed. So there were 23 sites in Belfast, a much higher number of sites in Edinburgh. And in Edinburgh, we were fortunate that they had decided to include some roads which were sticking at 30 miles an hour. So they'd kind of given us a positive control site to look at. I should have explained that the scheme in Belfast only focused on the city centre, which is why there's a smaller number of sites, while the scheme in Edinburgh covers the whole of the city and even gets out in a little bit into West Lothian towards Livingston as well. So there's it was a much larger scheme in Edinburgh, and because of this difference in scales, what happened in Belfast happened kind of on one single occasion. In Edinburgh, it was implemented in a series of steps as kind of areas of the city went at different points, building up until everything had happened. And in Edinburgh, we got to a point where at the end of the intervention, about 80% of the distance of roads across the city were on 20 miles an hour limits. They kept a core network of 40 and 30 miles an hour kind of in and out of the city, but everything else went down to 20. So that gives you speed, volume, and collisions and casualties data. We were also interested quantitatively in the concept of livability. Did it make these a more pleasant place to live? And you'll see why that happens when I talk about the policy process. And there's an auditing tool called Maps Livability that could be used by people sat at their computer using Google Street View, because you can look back historically at previous images of Google Street View. So we were able to see how livability had changed. So this is data from the pneumatic sensors looking at speed in Edinburgh, and you've got after data with the solid line and before data in the dashed line, and it's covering the point from 11 p.m. one day through to 11 p.m. the next day. You can see that people tend to drive faster overnight, and then during the day everything drops down, all kind of things that we would have predicted. And we can see before versus after a couple of miles an hour difference, maybe even just 1 mile an hour difference, depending on time of day in speed, average speeds of vehicles. So we were able to kind of quite quickly confirm that the change had reduced vehicle speeds, which is kind of tick one thing we were looking out for. But we knew that this kind of overnight period was much more risky. And we were also using Stats 19 to look at casualties and fatalities, and we could see a 44% reduction in Belfast and a 23% reduction in Edinburgh. But this is relative data, and actually in absolute values, it's very small numbers. Before we got the funding for the project, we did a lot of power calculations, and either we needed to be assessing 20-mile-an-hour limits across a much larger area, or nefariously increase the number of accidents beforehand. To do a study that detected a statistically significant change in accidents requires a really large area or high number of accidents. So we knew we weren't going to be powered for this. And it has been one of the major criticisms of the study that we just didn't have the power, but it's very hard to have the power to do this kind of work. And actually, for me, part of the question is, so what? We knew already that fatal injuries were much lower at 20 miles an hour than they are at 30 miles an hour. That's why the councils were interested in doing this. So this was something we kind of had to assess as part of the study, but wasn't really a major area of uncertainty. We knew this was happening. So this is where we moved much more into how did it happen and how did people respond to the intervention. So jumping to work package 3, we were interested in understanding the steps involved in each city getting to the point where they could adopt this policy. So there's a lot of going through the minutes of the councils involved. And what we found out was, unsurprisingly, leadership is a critical point here. Getting key politicians on board with the idea of the restrictions was critical. Trying to do this in a non-partisan way, getting people kind of across the political divide involved seemed to be important, and kind of the work that politicians and policymakers do to kind of get people on board with ideas was critical. There was interest in what the kind of public support was. So we definitely saw kind of those that were more interested in accident prevention and road safety and more supportive of 20-mile-an-hour limits. And the cycling lobby were quite interested in, quite kind of critical in pushing forward the policy. There was much more kind of ambivalence in Belfast. It was a much smaller scheme, and they didn't go to quite they didn't put in as much kind of awareness raising as had been done in Edinburgh. There was I think it was about a 12-year lead-in period from when we first were able to spot people talking about 20 miles an hour in the council minutes through to the point that this was implemented. So it was a long discussion. Edinburgh also made the step of doing a pilot scheme. So in one small area, if anybody knows Edinburgh around the Meadows, they implemented a 20-mile-an-hour limit as a pilot scheme. So it's close to quite a few schools, a family-oriented area, and quite a positive attitude towards walking and cycling. And what they were able to show was that before the pilot, 2/3 of people were against 20 miles an hour limits. After the pilot, that had risen to 2/3 in favour of the limits. And it also gave them a chance to test some of the, were they able to detect a change in collisions and casualties. This wasn't done by the university, this was done by the council as part of their kind of build up, a kind of slow chip away at resistance to the 20-mile-an-hour limits. And you also saw in the discussions what we've called selling the dream, how the dialogue around what the limits would do changed as time went by. So, you start with a position of increasing road safety, and by the time things were being implemented, you saw a much kind of wider range of outcomes being talked about, the cities being more attractive, people having healthier lifestyles, walking and cycling more, improving the environment and air quality, the sustainability of places, lower emissions, lower crime, thriving businesses. They kind of were doing a bit of a marketing job and expanding who it appealed to and what the policy felt like it was going to change. And you can see that's why we then embedded assessing livability and some of the other outcomes within our evaluation to see whether these kind of claims were backed up by the data. So in both cities, it took a long time. It was a gradualist process, and it was quite helpful in Edinburgh to start with a bit of a pilot scheme to get some part of the city on board with it. I've not taught you much, but interestingly, the opposition more often came from businesses than from the public. Edinburgh has a kind of effectively council-owned bus network, and they were quite resistant to the intervention, kind of concerned that it would increase journey times and things like that. And the taxi companies were another quite vocal group that were resistant. And people seemed to like the idea of the zones rather than the introducing limits rather than zones because of the reduced kind of roadworks and things like that they're involved. It was quite quick and easy to implement the limits. So that kind of supported a large scale scheme. So let's move on to how the public experienced things, because that was going to be critical, really. You know, did the public act on what was happening? We think we're seeing that because of reductions in speeds, but understanding how people reacted was really interesting. How were the effects or lack of effects experienced by the general population? What causal pathways and mechanisms were reported? And are there unintended or unexpected pathways and consequences to be considered? So my brain went blank for a second there, but kind of getting a sense of how the public were involved was important for us, especially because we've got this idea that the 20-mile-an-hour limits were going to lead to increased active travel, so more cycling and walking, and that is dependent on whether people see the roads as safer or not. And this is where understanding how the public responded to the intervention was quite critical. And there was quite a bit of work. So Work Package 2 undertook the qualitative work, which was focus groups with 60 participants in Belfast and 100 participants in Edinburgh. These were not just members of the public, but also, you know, we tried to do focus groups with taxi drivers and professional drivers and things like that as well. And across both cities, there was a kind of 4 main themes came out. One was around the awareness of the new interventions. One was around the signage, one was around enforcement and behaviour change. So I've got a couple of quotes for you here. Somebody in Belfast who was a city centre worker. It's hard to see where it starts because the signs aren't very obvious. It's impossible to see where it ends because there's no sign telling you that you're back at 30 again. It's confusing for people when they don't know where it starts and ends. And then a parent in Edinburgh. But it's a very valid criticism that a lot of people made that the signs were too small. And that, I mean, I think, to be fair, quite a lot of the implementation of it by the council left a bit to be desired. Yes, I think the signage was inconsistent, and I think that it's targeted towards people who are familiar with the system. So you might be familiar with these little repeater signs. They're very small. You can kind of miss them. So it was a kind of interesting bit of insight there. And Edinburgh even had like a mascot for the scheme. They had leaflets through the door. There were education going on. So even in Edinburgh, we were seeing that people were kind of missing it. It's quite hard to get through everything that's grabbing people's attention these days to capture their attention. And across both cities, there was initially an agreement that just warning letters would go out if people exceeded the speed limit. We didn't go straight to issuing fines. So it took a little bit of time to get awareness there, and investing time and effort to make sure the public are aware and on board, I think, is a valuable step for people. Using the maps data from Work Package 1, so these audits of Google Street View, we were able to show an increase in the livability of spaces on these streets that had newly adopted 20-mile-an-hour speed limits. So across both cities, we were able to detect improvements in traffic and transport, general improvements to the place, so the kind of number of people out there. And in Belfast, we could see more use of bicycle racks and improved pavements in Edinburgh. Belfast, we also saw reductions in parked cars and reductions in the number of moving vehicles. So the volume was something we could look at with this data. Because of the extent of the scheme in Edinburgh, it's a bit harder to see what was going on in Edinburgh. And we included quite a lot of more rural and residential areas than the Belfast scheme did. And this was the study I got particularly kind of hooked on and really interested in. So this was led by Work Package 1, where we did an intercept survey at various shopping centres around the city as areas got involved in the adopted the 20-mile-an-hour limits, where we were conducting a survey around the public perceptions of the speed limits. Hundreds of people took part, and we did before, after, and I think it's before 6 months and 12 months. We'll look at it. It comes up on the next slide. And as with any survey, lots and lots of questions. So to kind of minimize the data and help make sense of it, we did factor analysis to try and make sense of the information, and pulled out 5 factors that are listed on screen, the kind of public attitudes or public perceptions of the intervention. We had one which was around detraction and resistance to it. People saying, well, those limits are for other people, they're not for me. I'm a safe driver, I'll continue driving how I want to drive. People who were showing support for the intervention. So interestingly, with factor 1, it wasn't just expressing a kind of resistance to the intervention, but also talking about behaving in a way that resistance. Factor 2 was more expressing support for the intervention without talking about how they would do that. Factor 3 is rule following. People that would just express, well, I'm going to do what the rules tell me to do. They didn't have a strong preference either way. And then we saw the safety of children and the safety for walking as 2 final factors, as people were kind of expressing those topics within the data. And here's just one example for this. So this is something that we picked up where at baseline, almost 80% of respondents agreed that they thought 20-mile-an-hour limits would lead to longer journey times. So they were expecting a longer journey time. And you can see in the stacked bar chart at the bottom there, that's the black and darker grey bars coming, so it's almost 80%. By the 1-year follow-up point, and almost by the 6-month follow-up point, that had dropped to 70%. So people had a conception around how 20-mile-an-hour limits are going to impact them, and that reduced a bit. And you can see that's both across the strongly agree and agree parts of the response there. So one of the interesting parts of doing this survey was picking up on kind of the perceptions people had and when they weren't true, and how this kind of helped get ongoing support for the intervention. What we were also able to show with this was that people's concerns about walking safety and child safety didn't change. They didn't notice that the vehicles were necessarily slower, or that it was safer for children to walk or play near the roads. And that's obviously a critical point for us in terms of then getting the outcomes on active travel. If people didn't notice things were safer, they were less likely to adopt cycling and walking more. So we weren't able to detect any changes in cycling and walking with this intervention. Some of that is because the data on that is really hard to collect and inconsistent, but it looks like because people weren't necessarily noticing that the roads were safer, it's harder to see why people would change their behavior in that angle. I'm not expecting you to take this in, but based on the kind of combination of all this qualitative and quantitative work, we were able to map out both the desired pathways. So the solid arrows in this give you what you expect, what you hoped happened. You change the speed limit as a rule, people drive slower, and that leads to improved safety. But you can also see there's lots of dashed arrows on this graph, on this plot, which are the unintended things that could happen that we were able to hear from people. So there's lots of unintended things to look out for within these interventions. So just to bring this bit of the kind of Work Package 2 and Work Package 1 together, we could see that while 20-mile-an-hour limits sound like quite a simple intervention, people react to them in quite complex ways, and have different understandings and experiences of the interventions. There are lots of interacting mechanisms at play and behaviors going on. It's really helpful to have comprehensive reporting of what was done, not just that the rules changed, but understanding what educational material was put out, what awareness raising was done, how enforcement was handled, to really help us understand what's effective or ineffective about an intervention. Overall perceptions and experiences were positive and seemed to get more positive over time. As people experienced it, they found it wasn't as bad as they thought it would be as an intervention. So, it became, people were more positive towards it. But I think we need to be kind of come up with routes around sharing the evidence of the safety to help dispel people's myths, to help people see whether things have actually got safer, if we're expecting to change things like walking and cycling with 20-mile-an-hour limits. So finally, the big kind of question everybody wants to know is, does it save money? And because I've told you that it's very hard to have a statistically powered evaluation of these kind of interventions, that has a knock-on effect on what you can do with the economic evaluation, because the economic evaluation would feed from the effectiveness data on collisions and casualties. So what we ended up doing was adopting something called a decision theoretic approach. And this kind of flips the question on the head a bit and asks the question, how effective would the intervention have to be for its benefits to exceed the costs? So we know how much the intervention costs. How many lives would you have to save? What kind of outcomes would you have to achieve for that to be cost effective? And then based on the data, how likely is that that level of benefit was observed or exceeded in the cities? So it flips things around slightly. In Edinburgh, we were really fortunate. We had a very good, close working relationship with the team at the council who were doing this. So we were able to obtain quite an extensive range of cost data around the design, supervision, project management, all these bits that formed part of the intervention, to understand how much it cost to do it, including some of the kind of evaluation they were doing, like the speed and volume monitors. And using the data on costs and the available casualty data, we were then able to explore whether that matched the cost of the intervention. The monetary value of reduced casualties and deaths would need to exceed the cost of the intervention. So 2.76 million in 2016 prices when this was done. And we were able to conclude that it's likely that the monetary value of the outcomes exceeded the cost of the scheme. So it's not, we weren't able to do a kind of cost per quality type thing that you look at, but we were able to say that looking at what we'd got, it looks like there'd been enough reduction in collisions and casualties to cover the cost of the scheme. So in conclusion, promising but not conclusive findings for a range of public health outcomes, including speed, collisions, casualties, fatalities, volume, and livability. However, we also showed that there are things you can do to improve your chances of success with an intervention like 20 miles an hour limits. So being underpinned by theory and designed to mitigate unintended outcomes and promote the intended outcomes. So understanding all those other pathways is really helpful, making sure that you're doing kind of myth busting and understanding what people's concerns are. I've met people that believed their car would explode if it just went at 20-mile-an-hour limits. They thought the car wouldn't survive that kind of treatment. So there's lots of misunderstandings here to get involved with, as well as the legal aspect of being able to change the law in the city around 20-mile-an-hour limits. It's important to consider what you're going to do in terms of education, awareness raising, and enforcement. And there was a lot of discussion around the cost to the police of any enforcement issues. Sometimes while you might think the police might be supportive, they're worried about having to chase people for what seem like relatively small issues. And being aware of the wider transport system, taking a systems approach and understanding what else is going on, what might be interacting or interfering with your intervention is important to understand. Because of the single kind of bus provider in Edinburgh, they kind of were able to disprove their own fear. They were worried that it would change their journey times, and because they've got the GPS trackers on the buses to tell you when they're arriving, they were able to show that it didn't actually have a marked impact on journey times. So they were able to do these things. But I think they're the kind of key messages. And you're very welcome after this to email me, or we've got plenty of time for questions now. And just to think, NIHR as the funder and all the different teams that are involved in conducting this study.
Amazing. Thank you, Andrew. That was fantastic. Would you mind stopping sharing your screen? And it's great to see that we've already got some questions popping up on the chat. So I'm going to go to Dan Lewer first, and then I'm going to go to Richard. I don't know who you are, Richard. I don't have your surname, but anyway, well, over to Dan Lewer to start.
Thanks so much. I really enjoyed that. That's really interesting. I was interested in your approach to economic evaluation, and I might have understood this wrong, but if the study doesn't have power to estimate a reasonably precise effect, or the result is kind of non-significant but might include an important effect, how do you then engineer that to show that it is somehow cost effective or makes sense economically, given that the sort of initial estimate of effectiveness doesn't really provide evidence?
Yeah, so my understanding, and I'm not the economist on the project, was it's more around looking at the likelihood of achieving an effect of a certain scale. So kind of where the traditional route would go, we've seen this size of effect, it is statistically different from zero. It hasn't happened by chance. What you're looking at the other way is going, right, what size of effect do we need to have achieved in order for it to be cost effective? And then going, what's the likelihood that the size of effect we've observed ties in with that scale? So it does, as somebody trained in statistics, it feels a little bit sketchier territory, but we were assured by the economists that it was a kind of, it was better than doing nothing, I think is the conclusion we went with. But still an area for lots of development, I think, because it's really hard when you've got rare outcomes like collisions and fatalities to do a powered analysis, really.
Okay,
Thank
thank you.
you.
So I'm going to go to Richard and then Kathy and then Sarah. So Richard, are you there? Do you want to unmute?
Yeah.
Hello, Richard.
Hi. Thanks very much for the presentation. Yeah, I was just interested because often we're seeing a downward trend already in these areas for collisions and KSIs. So how did you determine that the actual changes you observed were due to the policy and not just a continuation of that downward trend?
Thank you, Richard. I might dig in while I'm listening to other questions in a minute and find you the paper, because we dug in this question. I think we did 4 different approaches in the end to really try and understand whether we felt we could relate these to the outcomes or not. So we did a more traditional difference in differences approach. So we looked at what the trend was already and saw how that would continue, as well as doing that in a fairly basic statistical approach. We used I'm going to forget the name of it. There was a kind of Monte Carlo approach used to extend time series and see if we could detect a change related to the dates of intervention. And because within Edinburgh they did it in phases around the city, we almost had a bit of a stepped wedge type approach, so we could look at different areas, but obviously you've got kind of contamination and spillover effects. As you saw, people didn't always notice when the sign stopped. So those were kind of 2 approaches. Within there, a more basic difference and differences and an enhanced version. We then also went through and identified control areas around Scotland, because around Scotland and Northern Ireland, Stats 19's kind of national data, we could have a look, and we matched control areas in terms of the indices of multiple deprivation and population density and urban rural, and did a comparison that was much simpler difference in differences approach, just kind of before and after comparison to see if we could see changes there. And finally, there's an academic called Elvik that's looked at power rules on the association between changes in vehicle speed and what that means in terms of changes in collisions and casualties. So we did more of a simulation model as well to see if we could detect something at that point as well. So we went about it as many ways as we could. I hope that's a useful answer, and I'll try and find the paper.
One quick follow-up then to that. Did you see that the behavior change was sustained?
So as you'll see, we mostly focused on 12 months follow-ups. It was about a 4-year study, and I wouldn't say that we've done anything beyond 12 months at this stage. We're having a bit of a think about whether we could follow it up even longer, but we then hit COVID that changed everything, and things like that. But I wouldn't say, I wouldn't comfortably say sustained in the long term, but I wouldn't say anybody in Edinburgh moans about 20 miles an hour anymore.
Thank
Lives
you.
Great. Thank you, Richard. And we'll maybe circulate the paper that you were talking about, Andrew, to the attendees. So I'm going to go Kathy, then Sarah, and then I'm going to go to David on the chat, just so we know who's coming up. So off you go, Kathy. Oh, Kathy, we can't hear you. You figure out your mic. I'll go to Sarah, and then I'll come back to you, Kathy, but maybe type it in the chat if it... So let's take Sarah's question while you see if you can sort your mic out, or type it in the chat for us.
So I think this has partially been covered by the Richard question, in terms of, I was going to ask, whether the 20-mile-an-hour zones were still there in Edinburgh, and whether you were doing longer term follow up, and if you had any plans. So you partially asked me that, answered that already. But I guess a comment to add to that is just it's a huge piece of work, and it's very much aligned with sort of the healthy urban places work that we're considering doing at the moment. So it might be useful for you to use some of your expertise if we do something in sort of Bradford and Liverpool, because I know they're going through lots of different strategies for their transport plans at the moment, and they do seem to be overly focused on journey times. So so thanks very much for presenting today, Andrew.
Great.
Let's see if Kathy's back.
Right, Kathy, do you think you've got anything to say, or no?
I've written something in the chat.
Yeah,
She's
okay,
also
so
interested.
Kathy,
If the speed limits are enforced in any way, as all streets can't have cameras, I think.
No, sorry, it's very odd. You definitely look like you're unmuted, Kathy, but we can't hear you. Joys of technology. So there's definitely enforcement going on. Obviously, as you said, you can't have cameras everywhere, but because of the extent of the intervention in Edinburgh, there are enough roads with cameras on that are catching people and sending out enforcement notices. So it's still being enforced.
Okay, right. I'm going to go to David and then John, if that's okay. Off you go, David. Oh, David, we can't hear you either. Disaster. Let me read out your question. So David wants to know whether there's any established methodology for measuring livability using Google Street View, and whether you can signpost us. Hope that's all right, David. I got the gist there. Yeah.
I'm glad it's not just me that has bad days with Zoom.
Yeah.
So Maps is an existing tool for looking at other things within Google Street View. Maps livability is an extension that does this. So I'll find out the papers, but if I open my EndNote right now, it will crash Zoom. So I'll send you a link to the papers afterwards. This was something developed by the team in Queen's Belfast. So quite a nice bit of work there you can use.
Yeah, it sounds really interesting.
Yeah.
Okay, John.
Yeah, very, very interesting presentation, Andrew. Thank you. We've touted it around the combined authority in West Yorkshire. It's one of those topics that everybody's supportive of, but nobody wants to implement because of that sort of background, low traffic neighborhoods, clean air zones, small minority of vocal motorists, smothering the debate for what most people want. So what's your sense of political traction nationally from the stuff in Belfast and Wales in particular? Because there were some very positive signals from Wales last year, weren't there? Edinburgh and Belfast, and nationally in Wales. Do you think has it got momentum? And then secondly, more specifically about your research, did you look at air quality?
And Kathy's just asked that question as well, so I'll come around to that one. Let me get this right. So political traction for was that the first question, John? Or have I missed one for that?
Yeah.
I'm not sure how much what happened in Wales has been helpful or not, because obviously there's been much more public resistance, and I think it probably helps push studies like ours, which looked at it in a much bigger scope around everything else you need to be doing. You can't just kind of do it in a very generic way, and I do think it is a complex intervention, and you really need to think about the context in which you're implementing it. Have you got are the conditions, are the roads able to support the kind of work you're talking about? And interestingly, because we've done this work, I get sent a lot of peer review work in this territory, and there's now this concept of self-explanatory roads. So the speed you should be driving down the road should be obvious to people based on what it looks like and the kind of material there. So I think that's an interesting one that pushes it back much more into people's own perspectives. Certainly in Scotland, it seems to have a lot of attraction. They're slowly turning all the villages around me into 20-mile-an-hour limits, whether it makes sense or not, as somebody who's fairly supportive. I support the idea, but I think you really need to think about things like parking on the roads. And in Scotland, we've got this rule now that you can't park on pavements, so it suddenly makes the transport network much more complicated. So I think there is traction and interest, but things need to be a bit more nuanced and thought through to do it well and not get more resistance to it. I think, in my village, they put a sign at one end, a sign at the other, nothing in the middle, and it just encourages people to feel a little bit more resistance to the rules rather than support it. So I think there is a story to be told alongside doing the work. In terms of air quality, that wasn't expertise we had in the team. So when we were designing the project, we went out and chatted to people, and obviously you've got the stationary monitors in most cities. But the conclusion from all the experts we spoke to was that the impact wouldn't be something you could really detect in an attributable way. And while the work we're talking about here is kind of mid-2010s, late 2010s, now if we were to look at it, you've got the increase in electric vehicles as well, that is kind of muddying the water to be able to attribute anything to 20-mile-an-hour limits. So it's really quite confusing to be able to detect a change. And everywhere's now introducing low emission zones up here. I think each of the Scottish cities now has a low emission zone as well. So that's quite hard to look at.
Kathy, I hope that answers your question. If it doesn't, you can follow up in the chat. Anna.
Hey, thank you. I guess a follow-on question from sort of John's first question around, you mentioned that businesses are quite often, have a negative sense of 20-mile-an-hour zones. I wondered if you had picked up any, did their perceptions change over time, or is there any research on does it actually reduce the amount of footfall at local businesses?
So aside from the transport companies, we don't have any specific insights. The Lothian buses were able to kind of demonstrate there's change. There hadn't been major changes for them. We didn't go down the route of engaging with businesses. I think it would have been very difficult in Edinburgh just because it's such a big area. And because we weren't able to really pick up on any changes around active travel, I think that's what would push changes in footfall, if we could show more people walking streets and things like that. And that's really, it's kind of a couple of steps removed from what we were able to do, and just didn't have the reliable. We worked closely with Sustrans, as you could see from the design, to see what data they had, but even when they've got things like cycle monitors, the weather disrupts them or things like this, so they're not a good source of data. But it would be an interesting area to look into in a bit more detail. Not something we managed to do.
Great, thank you. Andrew, I thank you once again for the talk. That was really fascinating. My question is it a no-brainer for councils that they should be implementing 20-mile-an-hour zones? Because you did do a lot of work on potential adverse events, but that seems to be gathered from people telling us stuff. Have you actually found any major adverse events for these types of interventions, and should we just be thinking, good idea, let's just implement them UK wide?
My simple answer would be no.
Mm-hmm.
It depends on what you class an adverse event and what your kind of focus is, because I think and it comes from my background in kind of participatory methods, doing to people is always going to get resistance up. So if it's being seen to be done to and without consideration of the system, I think it is a risk for councils to look at. If it's done in a more considered way, to think about kind of how you get people on board with it, how you sell it to people, is quite an interesting. I think that's more of a no-brainer approach, but it requires you a bit of brain to think about how to go about doing that work and getting populations on board with the intervention. As we saw in Edinburgh, the pilot zone is a really useful way of doing that, getting a little bit of testing, getting some people on board, lots of leaflets and promotion to help people understand. If you just do it without much kind of public consultation or engagement, I think it's a risk.
Yeah.
Even I think the health outcomes are positive. I think it's worth doing from that angle, but it's a tough one.
So it's all like so many of these types of things. It is all about bringing communities with you, the importance of participation, and I think also the loud voices and the political will as well. So it's almost the process and implementation of these that's the tricky aspect. Sarah.
Yeah, I was just going to follow up on that bit as well, because we did a housing study with Carmarthenshire Council, and they were a really good landlord, and they brought everyone with them. They asked them to choose what tiles they wanted around their fireplace, that kind of thing. And even though we didn't do the qualitative analysis in that study, the quantitative showed really, reductions in health conditions, emergency admissions to hospital, that kind of thing. Whereas there was another study, Arbed, that it was basically improving insulation for homes in Wales, and it was effectively done to people, and that they did focus groups in that study. And some of the the reactions of the people who didn't want this done to their home, even though and their perceptions about that it would increase mold, and in some of it I think probably did, that they really didn't want it, and we didn't see the quantitative results weren't as obvious, but yeah, the qualitative and the process was really, really interesting to understand. So yeah, I guess that does continue through as a theme for everything that we try and do. It's really interesting. Thanks, Andrew.
Great. Okay, so I feel like we may have naturally come to the end of questions. There has been at least a couple of comments in the chat, Andrew, about the livability stuff. Sarah's very kindly popped the NIHR report in there. If there's anything else or any other references, if you email Amy or myself, and we'll circulate those round. So if there are no more questions, I would like to you to join me in thanking Andrew once again. It's difficult to do that online, but I'm just going to do a little clap. Thank you so much, Andrew, for taking the time to speak to us today. Fantastic work, and yeah, as Sarah says, I hope that we can find some way to align our activities and work together in the future. So thank you very much.